Good evening, everybody. Today we are going to do anesthesia MCQs. Anesthesia is a very important subject as far as Neet PG and INICT is concerned. It has a coverage of lot number of questions, about 10 to 12, and it is a scoring subject. It is absolutely a scoring subject. You have to master a few limited number of concepts and practice those questions. That's enough to master, get a good score in this subject, and automatically if you get good score, your rank will move forward. So let us begin with the first question. All are indications for one lung ventilation except. The four options are: A, bronchopleural fistula; B, massive hemorrhage in one lung; C, video assisted thoracoscopy; and D, cardiac surgery. See, one thing I want to tell you is that one lung ventilation is not required in cardiac surgery. It is required for thoracic surgery and for lung suppression, but it is not required for cardiac surgery. So the correct answer here is D, cardiac surgery. All are benefits of supraglottic airway device over endotracheal tube. A, it is less invasive. B, it causes less hemodynamic alteration. C, it prevents aspiration. D, it requires less time for insertion. Except it prevents aspiration. Now, this endotracheal tube is the best device to prevent aspiration. There is an increased incidence of aspiration of gastric contents with laryngeal mask airway, that is supraglottic airway. The laryngeal mask airway is a supraglottic airway device which sits in the hypopharynx and partially protects the larynx from pharyngeal secretion but not gastric regurgitation. Advantage of supraglottic airway are: it is easy and rapid, less invasive, better hemodynamic stability, very useful in difficult intubation, less tooth and laryngeal trauma, does not require muscle relaxation, does not require neck mobility. The disadvantages are increased risk of gastrointestinal aspiration, less safe in prone or jackknife position, less secure airway, greater risk of gas leak and pollution. It can cause gastric distension also. So the correct answer here is C. It prevents aspiration. The most frequently reported malfunction in a medical gas pipeline system are: A, inadequate pressure; B, cross connection; C, excessive pressure; and D, alarm dysfunction. Let us see the pipeline problems. Some of the pipeline problems are: inadequate pressure, most commonly reported; damage during construction projects; fire, theft of N2O tanks; environmental, earthquake, lightning; depletion of central supply; human error, accidental closure of shut-off valve; obstruction, debris following installation; kinking, leak, obstruction of a host; contamination. So the correct answer here is A, inadequate pressure, which is the most common one. The color of shoulder of oxygen cylinder is: A, white; B, black; C, blue; yellow. Color of shoulder of oxygen cylinder is white and the body is black. So the correct answer here is A, white. Massive transfusion of stored blood results in: A, citric acid toxicity; B, hypokalemia; C, metabolic acidosis; D, hypercalcemia. It is citric acid toxicity. Gene for ryanodine receptor mutation in which is responsible for malignant hyperthermia is located on which chromosome? A, chromosome 19; B, chromosome 17; C, chromosome 18; D, chromosome 16. This malignant hyperthermia is a genetic autosomal dominant hypermetabolic muscle disease. So, and it is on chromosome 19. So, gene for ryanodine receptor mutation, which gene is responsible for malignant hyperthermia, is located on chromosome 19. Please click the link in the description box to join the 2-day Ultimate Neet PG Breakthrough Blueprint Masterclass. It will help you to revise in a very appropriate manner all the 19 subjects, and it will give a boost to your preparation. And first 10 people who click the link in the description box will get this masterclass absolutely free. Please like, share, and subscribe. And every day attend this live MCQ class every day. It is being held since last 6 months. First sign of accidental intraarterial injection of drug is A. Pain, B. Pallor, C. Cyanosis, D. Cording. It is pallor. The first sign of accidental intraarterial injection of drug is pallor, and the first symptom of accidental intraarterial injection of drug is pain. So the correct answer here is B. Pallor. The highest concentration of oxygen is delivered through A. Nasal cannula, B. Venturi mask, C. Bag and mask ventilation, D. Mask with reservoir. Bag and mask ventilation 100% oxygen. Mask with reservoir 80 to 90% oxygen. Venturi mask maximum 60% oxygen. Nasal cannula maximum 40%. So the correct answer here is C. Bag and mask. A 20-year-old man was running on the road. He suddenly collapsed. First thing to do is A. Check for pulse. B. Chest compression. C. Call for help. D. Scene safety. Always look for the scene safety first. It is D. Correct option here is D. A patient with stable atrial fibrillation, what treatment should be started? A. IV ibutylite. B. Immediate cardioversion. C. Amiodarone. D. Sotalol. It is IV ibutylite. Where should you attempt to perform a pulse check in a child who is anywhere from 1 year to puberty? A. Brachial artery. B. Carotid or femoral artery. C. Radial artery. And D. Femoral only. The correct answer here is B. Carotid or femoral artery. The depth of anesthesia can be best assessed by A. Pulse oximeter, B. End-tidal PCO, C. ABG analysis, D. Bispectral index. The correct option here is depth of anesthesia can be best assessed by bispectral index. Most commonly used nerve for neuromuscular monitoring under anesthesia is A. Radial, B. Ulnar, C. Glossopharyngeal, D. Vagus. It is the ulnar nerve. Best site for core temperature monitoring during malignant hyperthermia is A. Oral, B. Esophagus, C. Axillary, D. Rectal. It is the esophagus. Distal esophagus is the best site for core temperature monitoring during malignant hyperthermia. The pulmonary artery, if you use it, it is most accurate but not used routinely due to higher incidence of complication. It is useful in patients who are already on Swan gauge catheter. Oral sublingual can be influenced by mouth breathing, tachypnea, and ambient temperature. So the correct answer here is B. Esophagus. The following are methods of invasive cardiac monitoring: radial artery cannulation, B. Pulmonary artery catheterization, transesophageal echocardiography, transthoracic echocardiography. Except it is transthoracic echocardiography. Transthoracic echocardiography is minimally invasive form of cardiovascular monitoring. Transesophageal echocardiography is an invasive procedure and could be associated with serious complication. For example, esophageal rupture and mediastinitis in presence of esophageal injury or disease. In the absence of esophageal disease, the risk is low. Radial artery cannulation and pulmonary artery catheterization are also invasive. So the correct answer, which is non-invasive, is the transthoracic echocardiography. Ashner reflex is seen in A. Cardiac surgery, B. Neurosurgery, C. Spinal anesthesia, D. Squint surgery. What is Ashner reflex? Ashner reflex is also called oculocardiac reflex. The oculocardiac reflex, also known as Ashner phenomenon, Ashner reflex or Ashner-Dagenini reflex, is a decrease in pulse rate associated with traction applied to extraocular muscle and or compression of eyeball. The reflex is mediated by nerve connections between the ophthalmic branch of trigeminal nerve via the ciliary ganglion, the vagus nerve. So the correct answer here is squint surgery. All are indications of evoked potential monitoring. A. Cerebral tumor resection. B. Brachial plexus repair. C. Mastoid surgery. Spinal fusion and infant instrumentation. It is The correct answer here is except it is a mastoid surgery. The indication of intraoperative monitoring of evoked potential are surgical procedures with neurological insult, spinal fusion and instrumentation, spine and spinal cord tumor resection, brachial plexus repair, thoracoabdominal aortic aneurysm repair. It also facilitates probe localization during stereotactic surgery. A heavy smoker, when posted for elective surgery, would be must be benefited if he stops smoking. A 3 to 4 days before surgery, B 1 to 2 weeks before surgery, C 2 to 4 weeks before surgery, and D 6 to 8 weeks before surgery. So the correct answer here is 6 to 8 weeks before surgery. Smoking should be discontinued for at least 6 to 8 weeks before the operation to decrease airway secretion and thereby avoid the pulmonary complications. Time after smoking, what physiological effects occur? In 12 to 24 hours, there is fall in carbon monoxide and nicotine levels. 48 to 72 hours, carboxyhemoglobin normalizes. 1 to 2 weeks, decreased sputum production. 4 to 6 weeks, pulmonary function test improves. 6 to 8 weeks, normalization of immune function. So the correct answer here is D, 6 to 8 weeks before surgery. During pulmonary artery catheterization, entry into pulmonary artery is denoted by A, increase in systolic pressure, B, decrease in systolic pressure, C, increase in diastolic pressure, D, decrease in diastolic pressure. It is increase in diastolic pressure. Most common complication of pulmonary artery catheterization is infection, thromboembolism, arrhythmia, pulmonary artery. The most common complication of pulmonary artery catheterization is the arrhythmias, and these are usually self-limiting. Since the occurrence of these arrhythmias is so common, it is considered as indicator of placement of catheter. So the correct option here is C, arrhythmia. Which among the following is the best monitor to detect abnormal hemoglobins? A. Pulse oximeter, B. CO oximeter, and C. Capnography, D. Spirometer. It is CO oximeter. CO oximeter is the best monitor to detect abnormal hemoglobins. CO oximeter utilizes an 8 wavelength sensor, unlike pulse oximeter, which uses 2 wavelength to distinguish between oxygenated blood, deoxygenated blood, and blood containing CO. CO oximeter is useful in measuring carboxyhemoglobin and methemoglobin. So the correct answer here is B. Plasma cholesterinase is reduced in all of the following conditions: A. Pregnancy, B. Liver disease, C. Malnutrition, D. Hemolysis. So the question is except. Plasma cholinesterase can be reduced by number of exogenous and endogenous causes like pregnancy, liver disease, uremia, malnutrition, burns, plasmapheresis, and oral contraceptives except hemolysis. So reduced butylene cholinesterase activity is seen in liver disease, pregnancy, malnutrition, old age, pregnancy. So the correct answer here is D, hemolysis, except it is given, so it is hemolysis. Which of the following is not a complication of succinylcholine? A. Increased IOP, B. Increased ICP, C. Increased BP, D. Decreased heart rate. Now let us see the side effects of succinylcholine. Cardiovascular effects are sinus bradycardia, junctional rhythms, ventricular dysrhythmias. Succinylcholine causes hyperkalemia, myalgia, masseter spasm. Succinylcholine can trigger malignant hyperthermia, increased intracranial pressure. Succinylcholine may lead to activation of EEG and slight increase in cerebral blood flow and ICP in some patients. There is increase in intraocular pressure, increased intragastric pressure. So the correct answer here is increased BP. Water content of soda lime is A 0%, 5%, 10%, 15%. It is 15%.